Well, you know, just because you sign up for hospice care, you elect the hospice benefit, doesn't mean that you have to give up treatment. You know, just because we're comfort and pain management care, doesn't mean that you know, if you get an infection that you know, you can't get treatment with an antibiotic or things of that nature. You know, you have a patient who is eligible for the hospice benefit and gets it versus the patient who is eligible for the hospice benefit and doesn't. The one who actually does get the benefit is, you know, based on diagnosis, you know, is estimated to live longer than the one who doesn't. So that's one of the misconceptions, is that, you know, you know, some folks can get on hospice care and we start going out there to their home, and you know, maybe they're getting an extra meal, they're, you know, having more reason to thrive. You know, some folks get on hospice care and actually start to do better, and they discharge and they graduate. You know, who are we? I mean, I just assume everybody who gets on hospice care live forever. I know that that's not realistic, but you know, not everybody's guaranteed 6 months. You know, you could be eligible for hospice care today and only receive a week. So it's a very underutilized benefit, and you know, I just assume everybody get a little bit of it. And as far as giving up hope, I hope everybody at least gets 1 day of hospice care.
Yes, I have dealt with that that fear from the family members more than anything. They are anxious about using that word hospice because they believe their loved one will feel like that they've just, you know, they're stepping down. And indeed, we try to help the families and the patients focus on the quality of the life that they have left and how it can be elevated to a much higher plane when they have that extra team of people helping them in this final journey.
Well, there's a lot of misconceptions about hospice, first of all. And so I think that when a person comes on service, you're right, sometimes they do think that they may be giving up hope. Like this is giving up or giving in to the disease and the disease process, which I don't believe is true. And I think that what we do is we help people find strength where others may see as a weakness, and things that others may see as a weakness. So we help them identify their strengths, and then that gives them hope. I think hope is different for the individuals and the families, which take care of the patient. And so for the patient, it may be little increments of making sure they're not suffering, they're pain-free, that their family's going to be okay, hope for the future. And for the family, I think the hope for the future is huge because they're often we know that they're going to be coping with a great loss. And so finding hope in the little things, I always tell people to, I encourage them to appreciate the moments because, you know, they're so precious. I think they're precious anytime, but especially when you're coping with a terminal illness. So I think finding hope in the little things is really important to a person. And then I also encourage them that it's not giving up or giving in when you elect hospice. It's truly accepting, some of it is accepting that I may have a terminal prognosis, but also being willing to allow the person to have the best quality of life that they can have for as long as that may be, whether that's 2 hours, 2 days, or 2 years. And so finding hope in the small things like, you know, I got up today, I was able to spend time with the family, completing a legacy project, things like that are what I think helps people get through the time that they spend with us.